The first couple of hours after you've had a baby are so special because you've met them for the first time and you're bonding and breastfeeding and doing skin to skin. But in the midst of that, your body is going through a lot of changes too, and your nurse will come in frequently and check on you to make sure that you're stable and well. The risk for postpartum hemorrhage or bleeding too much is very high during the first couple of hours following the birth of a baby. So you can expect your nurse to massage your uterus and to check your blood pressure frequently. When I say massage your uterus, imagine what you do if you've ever made bread and kneaded it on a counter. That's literally what we're doing. We're massaging the uterus and stimulating it to contract because this helps to control bleeding. Essentially, during pregnancy, your body is sending a large amount of blood flow through the uterus to feed your baby, and those vessels have achieved superhuman strength. They don't go right back to normal after the baby's born. It takes about 6 weeks for your uterus to heal. So, if your uterus didn't cramp down really tight over all those vessels and act like a tourniquet, you bleed too much. So, in addition to massaging your uterus and checking your blood pressure to monitor that, your doctor is going to order Pitocin to be given through the IV after your baby's born. And this also helps your uterus to contract. If we see signs that you're bleeding more than we'd like, we can try additional medications, all of which help to get the uterus to contract down and control the bleeding. The uterine massage can be really painful, especially if you didn't have an epidural, or if you did, as time goes on, your epidural starts to wear off and you start to feel that uterine massage. It's like rubbing salt in a wound. It's the least favorite part of my job, but it's essential and it's important to the woman's overall well-being. As for bleeding, you can expect it to be kind of like a period that normally lasts 4 to 7 days, only stretch it out over 3 to 6 weeks. So if you consider a normal period, the first couple of days are usually the heaviest flow, it's bright red bleeding, and you have the most significant cramping. So this is like the first week or two following delivery. You have the most flow that you're going to have during the postpartum period. It's bright red and you experience significant cramping. But as time goes on, the flow should become lighter. It kind of changes to like a pinkish or brownish color, just like a period, and that's evidence that you're not actively bleeding anymore. And then at 6 weeks, you'll see your doctor for a postpartum visit, and by then, you really shouldn't be having any bleeding at all, and you should just be back to normal white discharge. Your doctor will talk to you about this, and if you're still bleeding, then further investigation might be necessary. Through it all, while you're bleeding, be sure you're using pads and not tampons, because we need what's in there to come out so that it doesn't form clots and contribute to more bleeding or contribute to infection. This is something to think about before you have your baby, because heaven forbid you send dad to the store to get you a supply of pads. You have no idea what he's going to come home with. So be sure to buy those for yourself before you go to the hospital to have your baby. Other things to consider are your bowels and your bladder. I had a friend call me once after she had a baby and she was in the hospital and she said, "My nurse is threatening me. She says that I have to pee or else I'll need a catheter." And she was wondering if that was necessary. And I hope her nurse wasn't talking to her in a threatening manner, but it is true. You have to have an empty bladder because the bladder sits below the uterus, and if the bladder starts to get bigger, it can push the uterus up and out of the way and prevent it from cramping down and controlling bleeding like I talked about before. So if you have a full bladder, we need it to be emptied so that your bleeding will be stable. In some cases, it's so swollen down there that you can't pee on your own, and so a catheter is necessary. If your nurses and doctors are advising that, it's good to listen and follow their instructions so that you'll be stable. Now the bowels, that's an issue in and of itself. It's normal if you have hemorrhoids after delivery. You may have had them during pregnancy because of all the increased abdominal pressure. But following labor and delivery, especially if it's your first baby, you probably pushed for 1 to 2 hours. And we tell you to push like you have the worst constipation of your life. So if you're obedient, then you may very well have hemorrhoids. And they can be really uncomfortable and even painful. And there are things you can do for that. There's Tux pads, which we also give for stitches. And then there's hemorrhoid creams. If they're an issue for you, talk with your doctor and they'll give you more advice and instruction on what you can do for that. But it is good to expect them, and also to expect the first couple of bowel movements after you've had a baby to be painful. Your doctor will tell you to take a stool softener, drink a lot of water, and eat foods that are high in fiber so that your stools are as soft as possible, and that of course makes it easier and less painful to pass. If you got Zofran or narcotics during your labor and delivery or postpartum experience, know that that will compound the problem because those are constipating factors. And you'll want to be extra vigilant at drinking more water, taking your stool softeners, and eating high fiber food. Stitches are another consideration. Keep in mind that about 85% of mothers who have babies go home with stitches, and it doesn't matter if it's your first or your 10th. It could have been due to an episiotomy, but in most cases it's just due to a spontaneous tear because we have something this big coming out of something this big, and the tissues are what have to give. So it's very, very normal if you have stitches, and the doctor and your nurses will talk to you about how to care for them. And they'll also check them out at your 6-week postpartum appointment to make sure that everything's healed properly. But in the meantime, you need to keep the area clean with a squirt bottle, and you can use things like Tux pads, which have witch hazel in them. That's soothing to broken skin and also helps with hemorrhoids, like I mentioned before. We have numbing spray, and during the first 24 hours, ice is your best friend. It helps to numb the area and reduce swelling, all of which also helps with pain. Most doctors also order a medication like Motrin to help with pain you're feeling from the stitches and everything, but also with cramping that happens as your uterus cramps down to control the bleeding. Cramping hurts, but again, tell yourself that it's your body trying to help itself. You'll probably also notice that if you sit up straight on your bottom, it's really uncomfortable and you feel a ton of pressure when you stand up, and this is all normal and part of the recovery process. You might try shifting your weight down a little bit, or we give you what's called a donut. It's basically an inflatable cushion for you to sit on, and that helps to alleviate pressure too. Breastfeeding is also another important part of the postpartum experience, and your nurses and lactation specialists will help you in the hospital when you deliver. But just because breastfeeding is a natural thing, certainly don't expect it to come naturally, especially if this is your first baby. It takes a lot of work. There's a learning curve for most moms and babies to overcome, especially when this is your first baby. So the nursing staff and lactation specialists will work with you in order to help breastfeeding be successful for you and your baby. Expect it to hurt for the first 30 to 60 seconds while you're nursing your baby. It's like excruciating toe curling, I want to rip my baby off kind of pain. But this only persists for a week or two until your body gets used to breastfeeding. And if you're having pain past that point in the feeding or in between feedings, then you should see a lactation specialist. They'll actually watch you nurse your baby and see if adjustments need to be made, because the number one cause of breast and nipple pain is an improper latch, and so they can work with you on that. And one other suggestion I have for you is to just leave your pre-pregnancy pants at home. After you have your baby, you'll feel like your stomach is gone and you're so happy about it. But then when you stand up, it just flops right back out and you feel like you're about 5 months along. And that's because your uterus is still pretty big. It needs to cramp back down to its pre-pregnant size over time. So immediately following the delivery of your baby, your stomach isn't going to be totally flat, especially when you're standing up. And that will mean that your pre-pregnancy pants won't fit. You'll want to bring something to the hospital to wear when you were about 5 months along or so. In summary, labor and delivery and recovery is not very glamorous, but it's totally worth it because now you have your baby. Good luck with everything, and if you have more specific questions about your circumstances, talk with your OB provider. And if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.